Good morning, everyone. Okay, so you have seen till prolactin, right? Okay, the next one, pars intermedia. So far, whatever we have discussed were about pars, this distillalis, right? Totally six hormones is what we have discussed. All that is about pars distillalis. Right. The next one, pars intermedia. There is only one hormone secreted from this pars intermedia, which is melanocyte stimulating hormone, MSH. Melanocyte stimulating hormone, MSH. The function of which is pigmentation. Right. Next one, pars nervosa. Third part, pars nervosa. There are two hormones secreted from this: oxytocin, vasopressin, which is also called antidiuretic hormone. So, any of first one, oxytocin, smooth muscle contraction. Next, vasopressin, also called antidiuretic hormone. The same one which we have seen in the hmm, the same hormone which we have seen in the excretory system, right? ADH or vasopressin. Diabetes insipidus. Now, see, one thing here which you need to understand is while we were discussing about this pituitary hormones, this oxytocin and ADH. If the question is about they are synthesized by, who will synthesize these hormones? Now, please ask Sir to check. Actually, your voice is not audible. No, no, Tarun. I can't hear you. No, actually, panel is connected. Harini, panel is connected, not your mics. It's fine now. Yes. Good. Hypothalamus, right? Uh, Released by, of course, which part of the pituitary? Posterior pituitary. Released by posterior pituitary. Understood, right? Because what happened there in the see this one. This one is the neurosecretory cell. This is the neurosecretory cell of what hypothalamus. But it is extended till post vasopressin release here. So it seems. Is it fine now? I'm audible now. Right. So what I was saying is this: this neurosecretory cell is releasing the hormone where in the posterior pituitary. So who is synthesizing this thing means neurosecretory cell of hypothalamus only synthesizing it. But this oxytocin as well as ADH will be stored in the posterior pituitary. Right, from here they will be released into blood circulation. Okay, so that is what a small difference is. Right, the next one, pineal gland. Only one hormone secreted from this, which is melatonin. Are you writing as a table or not? While making the notes itself, write in a way like you can revise easily. Okay, coming to the functions, diurnal cycle. Diurnal cycle. Diurnal cycle means we have the 24-hour rhythm, right? Whatever the 24-hour rhythm we have, that rhythm is maintained by this only. Next, body temperature. It will influence metabolism also, pigmentation, in female menstrual cycle, and also defense capability. All these are maintained by this. There is no hyper secretion, so just leave that column. posterior side is. On the posterior side, it is not connected. The same gland only. This is the anterior side. This one is the posterior side is. It is connected only in the anterior side, and we call this connection as isthmus. Isthmus. Isthmus means connection. Even you will see this in the fallopian tube also, right? So it is bilobed, connected by isthmus, connected on the anterior side, not on the posterior side. Right. Apart from this, when you see the cross section of this gland, you can see follicles or stromal tissues. I will show you that also. Just a second. Yeah. This is what the location is that we are talking about. On the anterior side, the front side of our neck, on the trachea, you can find this thing. Next, little detailed structure is this. Next thing is, this one is the anatomy directly. Yeah. So when you see the cross section of this gland, you will find many follicles like this. Which one is the just a second, it's not that clear. Give me a second, I'll open a different document. Okay. This is how the cross section of thyroid gland will be. So what you see here is there are different follicles. This one is a cross section. TS, transverse section of thyroid gland. These are the follicles, thyroid follicles. Three follicles are shown here. One, two, three. Three follicles are shown. So follicular structure means this only. So what these follicular structures are having is there are follicular cells, right? These cells are follicular cells. These follicular cells are the one that secrete thyroid hormones, right? Surrounding that, there are parafollicular cells also. These will secrete thyrocalcitonin. We'll talk about these hormones. The other hormone, thyrocalcitonin, TCT, will be secreted from this. Right. And the central portion of it is what we call follicular cavity, in which there is a chemical called thyroglobulin will be present. Blood capillary. The capillary means blood capillaries. In this, draw this thing because this in the text it is mentioned actually. What exactly is this? So just draw this thing, but mention, label these things only. Parafollicular cells, this one, follicular cells, thyroid hormones. Understood, right? The structure, everyone? Yes or no? Okay. So draw neatly. This one. hormones: thyroid hormone and thyrocalcitonin. These are the two groups of hormones. From follicular cells, thyroid hormones. So this is what we are going to see now. Right. Just a minute. Don't write, just see once. When you see these thyroid hormones, when we say thyroid hormones, actually there are two different types of thyroid hormones: tetra iodothyronin and triiodothyronin. These are the two types of hormones present. Tetraiodo, triiodo, this is called T4, whereas this one is called T3. These are the two types of hormones. So the meaning of this tetraiode is what? It has four iodine molecules, whereas this one has three iodine molecules. So iodine is what the component of these two hormones, both of these hormones. Right. Next, basically these two together are what we are going to call iodothyronins. Right. Now, coming to the functions of this, see, very, very important function is this: they will maintain BMR, which is basic metabolic rate, which means now whether we are active or not, irrespective of our body activity, there will be always some metabolism taking place. Some basic metabolism will be always running, irrespective of our body activity. Right. In which there will be some calorie consumption. Right. So basically, I can say rate of this calorie consumption, which is necessary for our life. Without this rate of means this calorie consumption, this energy consumption, body cannot run. So this basic metabolism is what we call basic metabolic rate. Without which, as I said, there cannot be survival. So this is the very, very important function. So that's what I'm going to show here in the hormones details. So thyroid gland, T4, T3, tetraiodothyronin and triiodothyronin, two different types of hormones. Both are secreted from what? Follicular cells. Follicular cells are secreting this. BMR, basic metabolic rate. In addition to that, they are also responsible for RBC formation, water and electrolyte balance. Basically, ionic balance, water as well as electrolyte balance. So all these are regulated by this one. The next step, if there is hyposecretion, I told you before the slash, whatever I'm writing are hyposecretions, after the slash, hypersecretions. That's what I mentioned in this table to easily represent. So, what happened? Achha. Okay, okay, just a second. Okay. So what I was saying, T4, T3, both are secreted from follicular cells. Functions include BMR, maintenance of BMR, RBC formation, water and electrolyte balance. All these are regulated by this. Next, hypersecretions. Hyposecretion of this thing will lead to goiter, cretinism, mixed edema, which is also called Gall's disease. All these are hyposecretions. Whereas in the hypersecretion, there will be exophthalmic goiter, which is called Graves' disease or thyrotoxicosis. Thyrotoxicosis. Does just write separately because in the table you can't accommodate that. So separately you can just write. Uh, First one, goiter. Goiter. It is due to iodine deficiency. Has the screen changed? Right. So goiter is due to iodine deficiency. So if iodine is deficient, what happens? As we have seen T3, T4. In both of these, iodine is the main component is. So if iodine is not present, T3 and T4 cannot be synthesized. That's what this hyposecretion is. So goiter is due to iodine deficiency. So apart from this, what happens is there will be enlargement of thyroid gland. If you see in these people, the neck region will be swollen, right? It is because of the enlargement of thyroid gland. Next, cretinism. And keep in mind, this is in the adult. Goiter is in the adult. This is in the child. Child in the sense, actually, not even child. Before the birth, it's basically iodine will be obtained from mother only, right? Before the birth. If mother was having iodine deficiency during pregnancy, if mother did not take iodine, so hypothyroidism in the pregnant woman in the early stages, I hope you understood, it will affect the child. So what is the reason for this means? Hypothyroidism in pregnant woman. It will affect the child. So what happens in the child means, as we can guess, it is required for basic metabolism. So if there is no proper metabolism, what happens? The proper growth will not be there. Therefore, there will be stunted growth. Growth will not be proper. Mental retardation. So there will not be physical growth. There will not be mental growth. So IQ of these people will be very less. Next, abnormal skin, deaf mutism. Deaf mutism means the person will be deaf as well as not able to speak, because all this is related to development. So basic growth will be lacking. So a person will be affected in all these aspects. Right. Next, this one directly will write exophthalmic goiter only. It is basically hyperthyroidism only. It's not something different. Hyperthyroidism only. So what actually happens here is the reason for this thing is uh, enlargement in the thyroid gland. Basically, if there is a cancer, for example, in the thyroid gland, it can lead to. If there is a cancer, understood, right? If there is a cancer, this thyroid gland size can increase, right, which will lead to hypersecretion of these hormones, right? So it can be cancer or some nodule formation. See, here there is enlargement of thyroid gland. But why there is enlargement of thyroid gland means iodine deficiency will lead. Actually, this is related to one feedback mechanism. But here, enlargement in the thyroid gland itself is the reason for this exophthalmic goiter, hypersecretion. Right. And the name, if you see, it is also called girl's disease, I said, no? It is girl's disease. The other name of this thing is the name exophthalmic goiter is because there is protrusion of eyeballs. See this exophthalmic. Ophthalmic refers to eyes, right? Exophthalmic goiter is protrusion of eyeballs. That is a characteristic feature of this condition. Right. Apart from this, there will be increased BMR. Again, as you can see, hypersecretion. Thyroid hormone is responsible for BMR. There is increased BMR, and also there will be weight loss. Now, these are all the symptoms of this. Finished. Okay. Sorry. Before this is about the first group of hormones. Next, second one, thyrocalcitonin, TCT, which is produced from the parafollicular cells. Already I have written this in the figure, anyhow. Para, parafollicular cells secrete this thyrocalcitonin. This is basically hypocalcemic hormone. Hypocalcemic hormone. See, whenever we come across this emic term, hypocalcemic. Okay, here HYPO hypo, as we know, decreased, right? Calci refers to calcium, right? emic refers to blood. Okay. So when we say hypocalcemic hormone, what we are trying to say, it will decrease the calcium levels in blood. Okay. The opposite one is hypercalcemic hormone. So emic as a suffix, meaning blood. So what is happening in the blood? Later, in one of the functions, we will come across this term. See this term, hypoglycemic. What do you understand by this term? Hypoglycemic. What happened? That's it. So hypo is decrease. Glyce here refers to glucose actually. Emic is blood. So the hormone that decrease glucose levels in the blood is hypoglycemic. Insulin is that only, no? Insulin decrease the blood glucose levels, right? It is hypoglycemic hormone. So this is how we use these terms. So whenever this comes, just keep in mind. So this one is hypocalcemic hormone. It will decrease the calcium levels in blood. So where this calcium will go, it will transport basically from blood, calcium will be released. This calcium will be transferred to bones. Always calcium will be moving between this bone and blood. Okay, so this one is making this blood calcium from blood to enter into bone. So it will increase the bone strength basically. That's why the name hypoglycemic hormone. Right. Next, as we have just seen, along with the thyroid gland, just behind this thyroid gland, even in the NCRT also it's mentioned, right? Where is it? Yeah, yeah. Just behind the thyroid gland, there are four, totally four parathyroid glands. So, what is the location of this parathyroid gland? Means they are present behind the or posterior side of the thyroid gland, associated with the thyroid gland. So, that is what this one is. Four. There are four parathyroid glands present on the back side of thyroid gland. Right, and where are these means? Each pair is present in each lobe. So each lobe consists of one pair. That's how these four parathyroid glands are. Right, and what this will secrete is, you can just continue the table. Parathyroid gland secrete PTH, parathyroid hormone. The name is also same. Parathyroid hormone. This one is hyperglycemic. Hyperglycemic means it will increase the calcium levels in blood. Okay, but in how many ways these calcium levels can be increased inside the blood means, just to try to understand the logic. I'll just discuss that little in detail. See, blood calcium levels. Now, for these blood calcium levels to increase, what are the different ways how the calcium can be added into the blood means? One in the intestine, in the food that we have taken. from the food that we have taken, if there is increased absorption in the intestine, if there is increased absorption of calcium, blood calcium levels will increase. Understood, right? Next, bone. As we have just discussed, bone consists of calcium. No, from that the calcium can leave and will enter into blood. This is one possibility. Third possibility is kidneys. That is in the nephron. Increased reabsorption. So and this mechanism also we know. Calcium levels, calcium will be reabsorbed in the kidneys. So what this PTH will do, parathyroid hormone will do is it will increase the calcium absorption in the intestine, movement of calcium from bone to blood, and also increase reabsorption in the kidneys. These are the functions of PTHR. So all this is leading to what? Increased levels of calcium in the blood. That's why it is hypercalcemic. If you just understand the logic, there is nothing separately to prepare in this. These are the ways how the blood calcium level can be increased. So what are the functions means individually? PTH will be doing all these jobs. There is hypersecretion of PTH. If these parathyroid hormone levels are increased, hypersecretion, what happens? What will be the effect on the bone? Why? Why? What happened? What is there in the sea? What this hormone is doing? Ma, this Taruns and Asif. I think you are forgetting your brains at home. Kindly bring them. Okay, along with the notebook and textbook, these textbooks and all. No, bring your brain also. Otherwise, you are not going to get anything. You're not even thinking. From bone, calcium is moving to what? Blood. So what happens to the calcium levels in the blood, bone? Decrease. So when calcium levels in the bone are decreased, what happens? Bones will become weak. That is what porous is. Okay, so if there is hypersecretion, bone strength will be decreased, is what it is. Now, these are the things which need not to be studied separately. Understanding is what is required. You can't keep mug up these things. Tarun, you have to change, man. Right. So first one, hyposecretion will lead to tetany. Again, this also we have discussed earlier. Tetany, if you remember, tetany. What is the reason for the tetany? What leads to tetany? Low calcium where? Low calcium in blood. Right. That is low calcium in the blood. So when the low calcium of blood level can be seen, what if there is hyposecretion of PTH? If there is hyposecretion, blood calcium levels will be decreased, right? Therefore, it will lead to tetany. That is what I've mentioned here. Tetany, hyposecretion, or hypersecretion is the other conditions. Okay, excuse me. Just see this thing. This is what the location of thymus gland is. Uh, Lungs, heart is here. This is where the thymus gland is. See this. This is where the thymus gland is. So what is the location of this thing means? Between the lungs, between the lungs, behind the sternum. Just write this description. Between the lungs, behind sternum. Right, on ventral side of aorta. That's the location is. Between the lungs, behind the sternum, on the ventral side of aorta. Right, like thymus gland, this one is thyroid gland, this one is also lobed structure. So you can see two lobes in this also. This one is the thyroid gland is above this. Here above the aorta, this one is present. This one is also lobed structure. There are two lobes. Right. See, basically, this thymus gland is primary lymphoid organ. This one is primary lymphoid organ. This you have studied in the 12th in the human health and disease, if you remember. Thymus along with the bone marrow is primary lymphoid organ. So what actually happens here? There will be T cell maturation. T cells will be matured here only. In fact, T cells are called T because of this only, right? T means thymus only, right? So T cells are related to what? Immunity. So thymus gland is directly related to immunity. So that's what these functions are about. T's, lymphocyte formation, later antibody formation, and overall immunity. Right. And also, what actually happens is, thymosins is the hormones is basically from thymus, hormones are thymosins, T cell maturation, antibody formation, and also overall immunity. Right. And just one important note here is what happens to the thymus gland size with age? Have you heard about this? Of course, in 12th you have studied this. What happens to the thymus gland size with age? Right, that point. The size of this gland decrease with age. That's the reason why these elderly people will be having low immunity as compared to younger people. Right. Okay, go through up to this, the textbook once. Let me know if you have any doubts. Up to thymus gland. Yes. Yes. Calcium levels decrease means bone mass is decreased. See, bone is actually mainly inorganic. The strength of the bone is because of the calcium salts, right? Calcium salts if decreased, overall bone mass is decreased. Yes, correct. Under osteoporosis, this hyperthyroid parathyroidism is osteoporosis. It can lead to osteoporosis. Yes. Under osteoporosis, we add this condition. Hyperparathyroidism is also one reason for osteoporosis. Hmm. Any other doubts? Can we close the session? Hmm. Okay, then. See you on Monday then. Bye, everyone.